In a time when technology often outpaces our understanding of its full implications, a new breakthrough in brain-computer interface, BCI, research stands out not just for its complexity, but for its deeply human potential. A team of researchers from the University of California has made a remarkable leap forward. For the first time, a BCI has translated the neural activity of a person into fluid, intelligible speech, nearly in real time. This isn't science fiction, nor a distant prototype. It is a present-day achievement with the power to restore one of the most fundamental elements of human identity, the ability to speak. The significance of this advancement cannot be overstated. The subject of the study, a 47-year-old woman who lost her ability to speak and move after a stroke nearly 2 decades ago, has now regained her voice through thought alone. For years, she lived in silence, relying on others to interpret her needs and emotions. But with this new implant, she was able to mentally formulate full sentences, which were then synthesized into spoken words by a sophisticated neural network. For the first time since her stroke, she could express herself in her own words, in her own voice. It's not just communication, it's liberation. One of the most compelling aspects of this development is the speed and fluidity with which the system operates. Traditional BCIs that attempted to reconstruct speech have always struggled with delay. These delays often made interactions clumsy, frustrating, and unnatural, more like sending text messages back and forth than having a conversation. That barrier has now been significantly reduced. The new interface achieves processing speeds of up to 90 words per minute with high accuracy, making it possible to engage in genuine back-and-forth conversation. This is a vast improvement over previous models, which were much slower and often prone to errors. What's especially promising is the adaptive nature of the technology. The neural implant, equipped with 253 electrodes, records brain signals every 80 milliseconds. These signals are then fed into a machine learning model trained not only on clinical vocabulary, but also on language drawn from real-world interactions, including film dialogue and social media. This dual-source approach means the system is better equipped to handle natural, everyday speech, bringing users closer to authentic communication, rather than stilted or overly clinical exchanges. Even more encouraging is the system's generalizability. It isn't tied to a single implant model or device, which opens the door for broader adoption and cross-platform compatibility. In a field often slowed down by proprietary systems and hardware limitations, this flexibility is a major advantage. It means that with further refinement, this technology could soon be integrated into a wider array of medical applications, potentially helping countless individuals who have lost their speech to trauma, neurological disease, or congenital conditions. What makes this breakthrough even more profound is its promise for the future. As sensors become more precise, as neural networks continue to evolve, and as real-time processing becomes faster and more accurate, the vision of a fully seamless brain-to-speech interface becomes less theoretical and more inevitable. And with that evolution comes a powerful promise that those who have been silenced by accident, illness, or age will speak again. There is also an emotional dimension to this technology that transcends its mechanics. The ability to communicate is deeply tied to dignity, autonomy, and emotional connection. Being able to tell someone you love them, to ask for help, to share a story, or simply to say how you feel, these are not luxuries. They are fundamental to what it means to be human. With this new BCI, those capabilities are being returned to people who have long been denied them. In a world where much of technological innovation feels cold or impersonal, this is a warm reminder that some of the most profound progress happens when technology is used to bridge our most human gaps. It's not about creating superhumans, it's about restoring humanity. While there is still work ahead, the system has yet to reach the natural pace of human speech, and further studies will be needed to refine its accuracy across broader populations. The trajectory is unmistakably optimistic. This is not just another research milestone. It is the beginning of a new era for neurological rehabilitation and communication technology. An era where thoughts can become words and silence can give way to speech, not eventually, but now.